Conservative media done right. You're listening to the SHR Media Network.
And welcome to a special edition of SHR Media Network. I'm Sackhead Clint. We're here live from Freedom Fest 2016 from Planet Hollywood, here with an interview, very special guest. I'm very excited about this, and we actually had a chance for about 10 minutes, 15 minutes to talk before the interview. Very excited to introduce Mr. Jeff Kanter today. He's here from Health Excellence Select. And a phenomenal idea. Again, we talked a little bit about it ahead of time, but Mr. Kanter, welcome, sir.
Yes, thanks. I'm glad to be here today.
And thank you. I'd love to hear about kind of a little bit about your background, who you are, what this project is, how you started.
Okay. Well, first off, I'm a lifelong libertarian and a serial entrepreneur, and have been in a variety of businesses over the years, some with mixed success and some with fantastic success. And I ultimately ended up in the insurance industry over a while and was very big in health insurance, but quickly withdrew from that because it ended up being such an obnoxious business to be engaged in. Every phone call was a complaint. So, but then when the Affordable Care Act came along, it created, like anything, whenever there's chaos, there's opportunity. And so we had a chance to turn things around a little bit and become proactive for a change. The sad reality is that most insurance products or anything related to health is a reactive situation. It waits for problems and then it tries to help. And that's okay when it comes to your car. If you just suddenly have an accident, that's when I need it. But if we're talking about my health, I don't want to suddenly discover I'm having a heart attack and go, oh, maybe I should have taken care of my diet.
Right.
So we're trying to turn the thing on its head a little bit and get ahead of your health issues and ward off the need to be at hospitals.
Excellent. And how's that accomplished?
Well, a couple of different ways. First of all, when that person joins with our organization, we immediately have them take a living health assessment, which allows them to figure out what their health is right now today and also to figure out where it should be. And then we work with a variety of applications like Fitbit and other kind of apps to help you determine and track the progress of your health. So you can actually quantify and qualify what you're doing and actually give you a path to run on. The problem for most people is they say, I should eat better, and then they Google something, and there's 18 million things that come up, and they're like, oh, the heck with it. I think I'll just go to Burger King. So we want you to have some ways that you can simplistically step into the things you need to do.
And you talked a little bit about the Affordable Health Care Act now, and what's that looking like. And I was doing some research on your site. By the way, I enjoyed some of the reading there and some of the things that you guys had up. Well done. But
thank you.
You talk about the need for, like you said, preventative health maintenance. And hey, when insurance, the analogy you used earlier was insurance is better for your house or your car.
Right.
When you're waiting for something to break. And why are you going to wait for something to break on your health? And so what types of preventative programs are available?
A whole variety of them, because it depends on the nature of the individual. Some people vary into like holistic or alternative medicines and those types of things, so we certainly make that available. Others sort of have a more traditional approach. But the idea is that there's no two things that fit everybody the same. Everybody's unique in that respect. So the idea of doing a living health assessment, which allows you to change from hour to hour, day to day, as things change or improve, and then also be able to plug you into different things. So let's say if your health takes a certain turn, there's certain groups or organizations that we can help plug you into for that specific situation.
And then is your goal is to move people away from this in my understanding, move people away from this health insurance industry almost to like a co-op, I guess, for lack of a better term, or a self-pay patient
It's more
system.
of a self-pay mentality, and in fact, if you're looking at the most current types of insurance products, between the high premiums and the high deductibles, they're already self-pay programs. Okay. So the reality is you want to be paying, but you want to get something for your money. And for most people that I've sold health insurance to in the past, you say, well, in the last couple of years, what have you done with it? Well, I haven't been to the doctor or done anything. So they're just paying a lot of money every month, literally for nothing, it's seemingly, peace of mind. So, but with us, we felt like you needed to have something that you were getting tangible on a regular basis, and at the same time that was proactively improving your situation, rather than just allowing things to deteriorate, because you're eating poorly, you're not exercising. Well, we know where that's going to go, and a lot of the way the medical profession is set up is they're only going to benefit if you get sick.
Well, and who doesn't love paying nonstop for services that you never see anyhow? I mean, really, who doesn't enjoy that? I love
I don't.
Right. Remember the,
I don't
the time
enjoy
we
that.
just kept throwing money in the garbage disposal
Right,
at the
because
studio?
we had nothing to
because
do.
why not, right?
Right, we enjoy it so much.
Especially in this economy where everyone's just booming
Well,
all the
sometimes
time.
what to that point, I would quip to some people. Let's say I had a client and it was $1,200 a month they were paying.
Oh, Lord.
Wow.
And it was like, well, let me ask you, what have you done with that product? Well, I've not been sick at all, so I really just spend $1,200 a month. I said, well, what would be more entertaining probably is if you went up to the back door of your house and just threw $1,200 out into the backyard and watched it blow around out there. At least it would be entertaining.
Right.
You get a nice money win.
One of those little money grab things going.
Have a neighbor come over and like just see how much they can grab at time.
Exactly.
So now what happens if somebody does get, say, catastrophically ill, or there is a major health need at that point? Is there does the self-pay patient system does that address that as well?
Yes, totally. Because truthfully, you could be exercising all day and eating right all the time, and lo and behold, you still have a heart attack.
Right.
I mean, genetically, or who knows why. So yes, it is important to be there for the person when disaster strikes. So we're definitely equipped for that purpose.
Okay.
But again, in actual practice, we see in the news all the time when they were pushing for the Affordable Care Act, it seemed like everybody was ill. But in actuality, 90+% of the population is healthy all the time. You're only sick periodically, and it's not like I have a heart attack every week. Right. It happens one time, and then years later, I'm still no problems or consequences of that. So that is the key. It's there for those emergency situations. I tell a lot of people that if you think of it like as a car, as an analogy, that insurance component or that disaster relief, that's the spare tire.
Okay.
And in most people's lives, how often do you pull the spare tire out of the car? And on top of that, how eager are you to pull out that spare tire?
You're not.
No,
right?
you want to avoid it.
Absolutely.
So that was the whole idea, is to build a program that was designed to ward off the need for that, but yet it is there in case something does happen.
Now, I have a question here. One of the things that was kind of on my mind, and some of our listeners may have on their mind as well. Right now, we do have an industry where costs are exploding because we have these insurance companies involved, the government's involved, and we know how the government loves to pay more for a hammer or anything like $500 for a hammer.
Nice hammer, though.
Right. So how is it? Is there a system in place, or does this address? Are you able to negotiate with doctors for a lower cost based upon this self-pay patient system, or are those same costs that these larger insurance companies are paying, or is the same rate being charged to patients who are, say, on a cash basis or paying?
No, actually, there's a lot of flexibility out there people don't appreciate. Oftentimes, and I'll relay a cute little story. I had a client years ago when I was in the insurance portion of the business, and the woman was constantly buying this one medication at the pharmacy, and it had a $20 copay. Well, the one time she went, there was a senior pharmacist, and he said, "Ma'am, you do know that drug only costs $5 if you pay cash." And she says, "But the person never told me that." She says, "Well, yeah, because you give them your card, and they would just charge you what it says." So the consumer really has no free market knowledge that there are pricing differences. So one of the keys that one of our secret sauces is that we provide everyone with a personal concierge. So using myself as a simple example, I had gone to a gastroenterologist, and they were requesting I have an MRI. Okay, well, that was what I expected, and at the facility that they worked through, it was going to cost $4,000,
Wow.
And then after usual and customary, it would net down to $1,800, but I still was going to be responsible for $1,500 of that. Well, I called my personal concierge, and they found me a place to do it for $390.
Wow.
So there's a lot of price variation out there, but the problem is that no one understands how to discover them. We know how to shop for gasoline or for milk because we can look at ads or we drive around and we see prices, but if I ask anybody what does gasoline cost, most people can tell me, but I say, well, by the same token, how much is an MRI? And no one has an answer. I've not had one person give me an answer. They know what their copay may be, but they don't know the cost of the actual thing.
Right.
So we've been working aggressively to introduce transparency back into the pricing model, but not relying on you as the member to know anything about it. You just with us have to be able to call a phone number and say, I need to get this done. Please find me the best price for that.
Now, do you have physicians on call or on staff or that are affiliated that are available to answer questions? Almost like some insurance companies, which you obviously are not, they have like a 24-hour advice nurse or something of that nature. Do you have somebody a system similar to that?
We do. We provide a 24-hour day doctor service because invariably people seem to get sick at the worst possible time, evenings, weekends, on vacation. And a lot of people find themselves in the emergency room because they don't know what else to do because it's the middle of the night and I don't know what I'm to do. And the problem oftentimes is that they're wasting time for the emergency room because it's not an emergency. It's a sore throat or something minor, but it's so excruciating they can't hold out. So we provide them a doctor that they can call 24 hours a day to say, hey, look, you better go to the emergency room right now, or don't even worry about it. It's such a minor thing. I'm going to phone a prescription in for you right now so you can just run up to the corner and get it.
Wow.
And that's an inexpensive way for them to function, quick and easy, but also keeps the emergency room from being all clogged up with unnecessary people in there.
Right.
Which is a huge issue right now.
Big problem.
Big problem.
I had a client, as a matter of fact, who had his daughter. She needed a Z-Pack, like an antibiotic, and ended up costing $1,500 because she was sick for a day and a half. He couldn't take it anymore. Took her to the emergency room. There was a $1,500 bill, and all they did was give him a little antibiotic.
Yeah.
So
5 pills and walk out the door.
Exactly.
And that's that's the beautiful part about technology starting to come in to play with this a lot more is we have that ability where the doctor can look at you or hear your symptoms. They know. I mean, they're professionals. They know this theory that you have to go to this one place to be seen is falling by the wayside. And I think that's one of the reasons why a lot of costs keep going up is hospitals and healthcare companies going, wait a minute, less and less people keep walking in the emergency room. Well, that's a good thing. That's a good thing if you're the person who doesn't have to walk into the emergency room, or if you're a single parent at home with 2 kids at 3 o'clock in the morning and one of them gets sick, and now you have to get both kids up, both kids dressed, drive to the ER, wait to be seen 4 hours trying to entertain 2 young children, et cetera, et cetera. Ways to streamline that obviously is both effective for the company, the hospital, and more importantly is the patient, and not just for the medicine portion of it, but for the state of mind too.
Well, that's for sure. And realistically, what we try to work with are a lot of proactive type doctors, because historically we've evolved into a situation where it's more advantageous for you to be sick for the doctor or the hospital than for you to be healthy. I'm in the Cleveland area where a Cleveland Clinic is, and there's a Dr. Chow there, and she was commenting how if you came in for a 20-minute stint procedure, we'd make $8,000, but if I sit and talk with you for an hour about your health, I'll make $15.
Right.
Wow. Yeah.
So where's the incentive? And in truth, you have to be in control, and that's a big part of what we preach is that you can't just buy and push the control off or the responsibility onto somebody else. You're responsible for your health. You're the one that put that thing in your mouth. That's what you ate. The doctor didn't tell you to eat that.
Right.
But by the same token, the doctor doesn't follow you home. So the doctor may say, you need to lose a little weight. And then they just hand you a pamphlet and send you on your merry way, and then nothing happens.
But it costs you a couple $100.
Well, that for one. But then what we do is our system follows you home. We're able to track and monitor what you're doing and give feedback to that doctor so that they can validate that you're actually doing something to improve your health, to follow their instructions. Because they don't have the time to follow up on everybody. They're busy seeing new people every 15 minutes, and they're sending everybody off with directives, and how many people actually follow up on those things.
So do the doctors work for you, or do they are they independent contractors?
No, we don't really contract with any specific doctors. They just support our mission, and we list them and recommend them. So you're able to go to any doctor that you wish, but some doctors are better than others. Some are more inclined to be helpful in that respect. So when they say, hey, look, I really don't have a doctor, and I live in this particular zip code, we're going to try to offer the doctors that are going to be more proactive, and so that helps that doctor grow their practice without having to try to stop being a doctor for a minute and becoming a marketing firm.
Right.
They want to just be the doctor.
And do they have price points already set based upon their affiliation? Or
Oftentimes they do. We'll work off of normal, we have some negotiated rates that we'll work back and forth with them because they're already accustomed to doing that type of stuff.
Right.
Other doctors that are cash-oriented, where they've kind of gotten away from the insurance practice, will usually honor whatever pricing that they're trying to work with, and we're able to help the price compare for you. So let's say there's a few doctors in town, and 3 of them are reasonably similarly priced, and one's astronomically priced. Well, we're going to educate you so that you'll understand the differences between those comparable doctors.
Excellent. And do you have different price points or packages available based upon somebody's either individual needs, or if there's like a married couple newly starting out, or maybe they have children?
Well, conveniently, we have some very fixed pricing. Normally in the industry, it's all based about age or location. So if you're young, it's cheap. If you're older, it's more expensive. If you live in a rural area, it'd be a different price than if you live in a downtown area. With us, it's the same across the country. It's $249 a month for a single person, $349 a month for a couple, and $499 a month for a family. And with the family, it's unlimited children.
Wow.
We also include no charge for annual physicals and checkups and things of that nature. And then in terms of the financial exposure, it's an incident-based program with an annual out-of-pocket. So as an individual, you're going to be responsible for the first $500. So if you went into the hospital and the bill ended up being $10,000, then we're going to share $9,500 of that, and then you'll be responsible for $500. If you're a couple, it's $1,000, and if you're a family, it's $1,500. So it is in fact affordable.
It is. But is that an? I'm sorry, Shaun. Is that an annual? Is there an annual cap, or is that per incident?
No, that's for the whole year. So if you're an individual, it's $500 for the whole. If you had a broken leg, you're going to pay the first $500 of that. But then the next week you have a heart attack, there's nothing coming out of your pocket because you already paid the $500 on the broken leg.
Wow.
Well, and the other thing too that dovetails nicely into cafeteria plans, where you have a healthcare spending account at a lot of businesses now, where that's exactly what it's kind of there for, is the outside expenses. So if you could combine the two as an individual, that would benefit you greatly, and you're golden, if you will.
Yeah.
I mean, it really is an amazing process, and it takes a lot of stress off of a young family, maybe with two young kids that they don't have a lot of money in the bank. But they know they need this. Health insurance is just ridiculous right now. I don't care what the federal government's going to tell us. I can tell you personally, my plan's changed 3 times in the last year and a half, and it's up to about 60% more than it was, and I'm getting probably about 40% less.
I have an option for you, Shaun.
as he hands me the Health Excellence Select. Thanks, Clint.
I'll tell you 2 stories that address exactly what you said. We had a client who needed to go to his wife needed to go to an obstetrician, and there was, in the particular program that they had a $6,000 deductible. And they said, well, can we make payments? They said, absolutely. And when you've made the $6,000 in payments, we'll schedule the procedure.
Yes. And I've heard that numerous times.
They didn't have a choice because they needed to get the procedure today. They didn't have time to take months and months and a year to make payments.
Wow.
And then another situation we've had where somebody found a specific hospital. Their kid was going to have some stuff done, and they found a very specific hospital, and they bought a health program that fit that. And then when they went to check in and they handed them the card, they said, "Oh, we don't take that anymore."
Well, why not?
Well, they said we opted to drop it.
Well, yeah,
He said,
because
but I bought this specifically to come here. They said, yeah, but we're not obligated to tell you that we don't take that anymore.
right, and that's. You find a lot of that in the medical field where, hey, this changed and we didn't have to tell anybody, or this got worse and we didn't have to tell anyone, and more expensive. I actually found out my medications went up by going to try to get medications.
Right.
And I went, oh, okay, that's fine, because we've been buying the same one for the last year at this price. Yeah, no, it went up.
So how does Health Exchange Select handle that? Is it a cash payment to the hospital, so there is no, we don't take that, but we accept this?
Well, our luxury is that we're able to, since we're a self-pay approach, that we tell everybody you're a self-pay patient with people helping you pay your bills. So to the hospital, you're self-pay. They don't have to understand that somebody else is also chipping in to have you to make sure you have that money in hand, and so they'll electronically bill. So we have a card. You just give it to the provider. You don't pay anything when you go, and then they'll go ahead and send us that bill, as it were, and then we'll negotiate with them. We'll be able to sort out a price if it's after the fact, meaning we've already went to go get that done. But like I said before, if we're able to pre-shop, because see, that's part of the deficiency of the program. You don't. It's like passing a bill to find out what's in it kind of a thing. No, I want to know what's in it before I pass it.
Right.
Well, when has that ever gone wrong in this country?
But we're going to get it right sooner or later, right, if we keep doing it that way.
Oh, of course.
So,
well, how can we not?
Yeah, it's like being in Vegas here. Sooner or later, 7's coming up.
Yeah,
right.
So,
and I keep believing that.
You may lose a few $1,000s before you win 100.
But seven will come up. I don't care what anyone says.
Right.
I'm a believer.
So the idea, what our approach was by being proactive, is we want to kind of shop around to find, either negotiate or find the best vendor or doctor or provider before you commit. Because once you've already spent $4,000 for a procedure, how much kind of a discount can realistically be had?
Right.
Well, it's all.
And they've kind of got you stuck because you've already done it. So.
But that's where the genius of you comes in.
Well, thank you very much.
Sir, we have to wrap up. Where can everybody reach you, find out more information?
Well, I would tell you that you're going to want to contact the Wild Ridge Group. That's our representative here for this program today. And they're at 970-306-7577.
And do you have a health site or a website that they can go to for health exchange?
Well, we have one special for this event. It's called libertarianhealthcare.com.
Outstanding.
Outstanding. And what about for post-event? 'cause it's
Post
something
event,
we
that
can
will still be
replay.
functioning. Otherwise, you can go to healthexcellenceselect.com.
All right, excellent. Sir, it's been a pleasure. Thank you
My
so
pleasure.
much
Thanks for
being
having
here
me.
with us today.
Great.
Thank you, sir.
Keep up the good work, guys.
And I'm Sackhead Clint, live from Freedom Fest 2016, Las Vegas, Nevada.
And I'm Sackhead Shaun. We'll be back shortly.
Conservative media done right. You're listening to the SHR Media Network.